There you go. Your video's
So-
going. Your video's going.
Shut the door. Thank you.
Hello, Reed from the parallel universe of Arizona.
Don't listen to him.
No, after this, are you going to come shut it off?
Yeah, I'll come after the period.
Okay.
Bye.
Liam.
Okay, who's somebody's homework this says?
It's supposed to be for this, missing plate.
I don't know. But your name's not, is this yours? Your name's not on it.
This. Yes,
Oh, I
it is.
didn't finish
It is
it.
in the back.
Yeah, but put it on the front, though.
I'm sorry.
Yeah.
Yeah, and I still have all weekend. I mean, wait, no, I still have all week tomorrow.
So do you have your homework?
No, because it's due tomorrow.
Oh, it's due tomorrow. Okay.
Not the letter.
Huh?
It's not science. It's the
Oh.
quick check.
Oh, I don't have that.
Oh, never mind. Here, never mind.
Yeah, this is health. This is health.
Yeah.
Do you have that? Okay. Azalea, still no name, honey. I need a name.
Wait, is Miss LePage not here?
She had an appointment. She was here this morning and had to go.
So it's Miss I and Miss LePage?
Oh, is Miss I have an appointment too?
Something like that.
Okay, thank you.
My mom got me and my brother all excited that we were not going to go to school tomorrow. Because she said, me and her and him were going to have a dentist appointment in the middle of the day that takes an hour to get to and an hour to get back home. And then my dad told me, then my dad said today, oh, she got confused. She has a dentist appointment. I was like, oh my goodness, why?
So you have to go to school.
Why?
Here, I'm going to give you this because you're getting chocolate on your chin. And Reed's going to be able to see you.
It's recording.
Yeah, Reed.
And you're right close up.
Yeah, Reed can see your chocolate.
Okay, so we're going to go over the quick check
There we go.
on page 41. So that's what you guys handed in?
Uh-huh. Yeah. Everyone except my dad.
Okay.
And
So, what's another name for a cut?
slit.
An incision. Okay, go ahead.
I was gonna say an abrasion.
No, an abrasion's not a cut. An abrasion is usually like a scrape. So another name for a cut is an incision. Like, think of it when a doctor does surgery, right? When they're cutting, they call it an incision.
I said slit, so.
Well, that's okay. She'll look at them. I'm supposed to collect them before you go over them, right? Yeah. That's okay. Okay. The scraping off of the epidermis. That's like if you're... Go ahead. Abrasion. Like, think of, you get an abrasion like if you're riding your bike and you fall off and you know how you kind of scrape your knee?
Rash.
Yeah. Yeah. Or you're running and you fall. Boom.
That happened to my brother, but he is wearing the pants he did. And they have huge holes where the knee is.
Where the knees, yeah. If you have pants on, like if you're in the grass, you might end up with a grass stain, and that protected your knee, and your pants took the beating. Okay.
That did not happen when I fell off my bike.
Well, that's good.
It went straight through my pants.
Oh, it went straight. Oh, so you did it good. You did a good one. Sometimes that happens. And overexposure to the sun. So what happens to us if we're out in the sun too much? Someone else. Gavin, what happens?
You get
You know it.
either sun poisoning or I forgot the other one.
Well, what happens to our skin?
You get burnt.
So sunburn, yeah. I don't know. It doesn't get into. Oh, okay, some of the other questions. Yeah. So overexposure to the sun, your skin will get sunburn. But there are other things. You can get sun poisoning. You can get heat stroke if you're out too much in the heat and your body hasn't been hydrated enough or
We
been
only heard of heat stroke and then heat exhaustion.
heat exhaustion. Okay, number 4. The body's reaction to extreme heat by causing the victim to sweat profusely. Yes,
What's profusely mean?
a lot.
So that's a heat stroke. Because the heat.
No, that's heat exhaustion.
Oh yeah.
Because
That's what I put in it.
okay, that's okay. Because I just wanna. Yeah, when a person's body reacts to extremely by sweating a lot, they become very tired, weak, and possibly collapsing. That's heat exhaustion. And that, if you don't treat heat exhaustion, you can get heat stroke. But heat exhaustion is kind of, that's your warning, your body telling you, you need to get liquids, you need to get out of the sun, you need to stop what you're doing. If you're playing a sport or doing something where you're really exerting yourself, it's time to take a break.
That happened to me when I went into a hot tub.
Oh, because it was so hot?
Yeah.
The heat.
Yeah.
Okay, the next one, number 5. Occurs when during hot weather, when the sweat glands do not release overheated body fluids. So what happens then?
Heat stroke?
That's heat stroke, yes. Okay, somebody else going to answer for me. The freezing point of body tissue. So, Sarah?
Hypothermia?
No, this is the freezing point. So what happens to our skin if it freezes? Frostbite, yeah. Is that what you were going to say?
Yes.
Yeah. Okay. Caused by lowered body temperature. So the body temperature becoming lower is
When when the blood tries to protect the vital organs.
It is, but do you know what that's called?
No.
Is it?
Heat stroke?
No, the low heat stroke. Our body temperature is going
This is
up,
cold temperature.
so it's going down. Sarah?
That one's hypothermia?
That one's hypothermia. But you're right, hypothermia.
Actually, I think we're supposed to have papers, and then so we can answer off the paper. That's what we usually do.
Is that what? I'm sorry. Do they usually correct? Well, do they usually?
We usually correct it with red pen.
Oh, they correct it while we do it?
Yeah.
And then
I haven't been here. I've been in the other English class with the older kids, so I didn't know the routine.
Well, we're a work in progress. That's all. So I will go. You got a red pen. We'll go over the answers quick.
So which one do you want? Which one?
Number 1.
Okay.
Okay, are you? Number 1 is incision. You got a pen, everyone?
Yep.
Number 1 is incision.
Hmm?
Number 2 is abrasion. Number 3 is sunburn. Number 4 is heat exertion.
Exhaustion.
Number 5, heat stroke. Number 6, frostbite. And number 7 is hypothermia.
I only got one now.
That's okay.
I got a couple of mixed stuff. I got 3. So.
That's okay. Okay, let's hand them back in, and then now, do we read or do I read?
You don't. We don't read. None of us really read. It's just like we go over stuff.
Okay.
So like we go over the bold print words.
Okay.
I thought we read the pages that she was assigned.
Because we have class till what time?
101.
Yeah, 101.
Okay, so we have I'm gonna. If you have questions, then we know we read it. Let's go through and read it. I'll read. If you want me, I will read it. I don't mind.
Can I go get some water first?
Quickly.
Why isn't Reed sitting at his desk?
Because
I
he's
think it's
invisible.
kind of disrespectful that he's sitting on the teacher's desk.
He's invisible. We just can't hear him.
Yeah, hey Reed. You like Cheez-Its? Here you go.
You can tell him to send us some sunshine, right?
Yeah.
We need it today.
So
Give your power.
Reed, when you come, you put you grab some sand and you put it in a jar and then bring it back and then dump it on the ground and that will make it warmer. So
He's talking to invisible.
we definitely do that in Invisible Reed.
And Reed's gonna.
Okay, we're going to talk about critical conditions. So when we would call 911. Okay, although you probably not had formal medical training at this point in your life, you can learn first aid procedures for many injuries and sudden illnesses. Yeah.
I know what to do when a person gets shot. You put pressure on the gun wound until an ambulance can get there.
That's right. We're going to talk about direct pressure.
Also, if they get cut with like a knife, if the knife is still in you don't take it out because that would
Or
just make them bleed
scissors.
out.
Because that'll make
That's
them.
true. It could be anything. It could be a piece of wood. Anything that's
Yeah.
if anything is impaled, goes through, breaks, goes deep into your skin. You don't ever want to pull that out because you don't know what injury has occurred underneath there, and you could pull it out and they could bleed to death, or
Yes.
you're not really sure.
Especially in a certain spot where there's a lot of blood.
Well, and where there's different veins and arteries.
So you just leave it in.
So you would leave it there and maybe wrap around it.
Yeah, get like a rope and tie it around, or if you have something like.
Because the doctors have to go and take like X-rays and see what the object.
So they're gonna be in pain while they're getting an X-ray.
They are gonna. Well, when they get to the hospital, though, once they get to the hospital,
They're probably gonna get them
pain
medication. Yeah.
Like, yeah.
They probably won't feel much.
Yeah.
But that is a very good point to know, because sometimes people don't realize that. But if something is gone in really deep, I mean, if you get a splinter in your finger, you can take that out.
Because that's probably like.
Yeah, that's not. But yeah, if something's going in really deep into the skin, like I'm sure you've all seen movies like where there's accidents or something and someone has a piece of metal stuck in their leg, or.
Yeah.
Well, I only know apply pressure to the gun when shot because of Chicago PD.
Okay, see, from TV
shows.
shows. With grandma. Yeah, I mean, and that's true. And anytime, it could be a knife cut. You have to, whenever there's an injury, you have to, and I'll read a little bit about that.
Yeah, any deep wound that is like won't stop blooding, you should probably apply pressure to stop the bleeding.
Yeah. So say you're wherever you are. You could be home, and say somebody gets hurt. And you know what to do, okay? But there's somebody else there with you. While you're helping them, what do you have someone else do?
You say call 911.
Yes, that is very important. You have to always call 911, whether you're giving someone CPR, like you're starting it. Before you're starting what you're doing, you need to make sure someone's going to call 911, because you want that ambulance coming, those people coming to help you as fast as they can get there. So you'll do what you can, but they need to be on the way. Because if you're sitting there for a half hour trying to help them and nobody's called the ambulance, it might be, how long is it going to be before the person has the ambulance there? A long time, right? So we want kind of everything happening at the same time. The following injuries and...
You're on Your Life.
Okay, so yes, the sight of blood. So the transportation of food and oxygen to all cells of your body, and the elimination of waste from the cells take place through your circulatory system. Because a person could bleed to death in just a short period of time, procedures to stop severe bleeding should always be started immediately, as you said. So, apply direct pressure. So you get a clean cloth. If you're at home, a towel, a washcloth, a clean t-shirt, any kind of piece of material that is clean.
What happens if you're in the woods?
Well, if you're in the woods, say you're in the woods with your sister and this happens, you would take your shirt off and you'd use that.
Or your sweatshirt.
Yeah, I mean.
Because, like, you're just like, and then you just, like, apply pressure with your sweatshirt.
I mean, but if you would want to take it off, if she's bleeding that bad, you want to make sure you're getting something on that so you can help pressure.
Or if you have, like, a pocket knife, you could just cut off a sleeve and then, like, put it on the...
Yes, you could.
Well, whatever's fastest.
Whatever's fastest, so that you can apply. It says place a clean, so like, say for instance, like Gavin said, say he's in the woods and it's his shirt, right? Maybe it says you want to put something clean. So maybe there was mud on the outside. Maybe you want to make sure that the back of your shirt that's clean is what's touching the wood. Or put it inside out to make sure what's clean is touching the wound. Does that make sense?
It's probably not going to be the cleanest on the inside either.
No.
Because you were sweating.
But it might be cleaner than if you had mud on the outside.
You're less likely to get an infection from sweat.
Yeah.
Than you are mud.
Do you have something to say, Gavin, before I read more? Go ahead.
Like, what happens if you don't, like, for whatever reason, what happens if you don't have cloth or anything like that?
Well, you got to be innovative. I mean, it's...
You could find maybe a vine and find a nearby stream.
Yeah, I mean, maybe... I mean, hopefully you'd have something.
Yeah.
You know, you'd have something on.
Or, like, at least if if your sister had a headband on, maybe.
Yeah, maybe
like
a cloth.
Stretchy headband. Then you could, like, take it off of her and then use her thing.
It makes you think that maybe every time you go in the woods, you might want to have a handkerchief around your neck or something that you could use, right?
Yeah.
But now everywhere I go, I pretty much just have, like, a mask with me.
So you have something, yeah. But I'm trying, like, something that's going to soak up blood. There's not really anything in nature that I know of.
Maybe if you had a backpack.
Oh, moss would.
Okay, so if you could find it, I guess.
And then
But you could just. The thing is you might have to. I'll use Isabel. Can you come here?
Oh no. But Reed needs to see too.
Well.
Okay.
So I think it would be important. Say she cut her arm bad, right? And you didn't have anything. The best thing would be maybe put your hand over it as you're walking back home, just to put as much pressure as you can. So you're gonna be full of blood, but you know, hopefully it would take off a little bit of pressure. You know, stop the bleeding a little bit because you're applying pressure while you're doing that. Yep. Instead, cover the cloth with another. Okay, if it soaks through, you want to put another cloth over it for 7 to 10 minutes. Okay, what also helps is if her arm's bleeding, you could have the pressure and then you raise it up, because that'll help.
Yeah.
Because now your blood, because the blood's going to go this way.
Yeah.
Instead of all the way to the injury and dripping. So
but
then
it still might drip just like that.
Yeah, it's still going to drip some depending on how.
Well, either way, if it's a deep wound,
it's still going to have blood if it's a deep wound. But at least it will help by elevating it a little bit.
Well, yeah, like if it's a little blood, you don't have to worry. But if you're like about to bleed out, then that's gonna.
Like from a gunshot.
Well, if it's that deep, then you want to do a tourniquet. I don't know if you've ever heard of that.
Isn't a tourniquet like?
A tourniquet would be like if someone say they cut their arm really bad here, right? What you would do if you have a belt. So you would.
I know. They put a tourniquet on when they take blood.
But usually, let's say the cut's here because you want to go above the cut. So say the cut's down here. you're gonna put something tight. A belt works.
A
You
rubber
probably
band.
learned some of this stuff in Scouts too, right?
Yeah.
A rubber band. Then you do. Because at the doctors when they take blood they put a rubber band.
That does. That will help some. But usually you're not going to have a rubber band. You can, like you said, you can cut part of a sleeve and wrap it around there and tie a knot. Get it as tight as you can.
Hair tie. That kind of works.
That might
Yeah,
get tight.
Because a hair tie could stretch pretty far. It could
Yeah, so
stretch
that might get kind of tight for you. So just anything, but that's a really bad, really bad.
Like how bad? Like going through your skin?
Yeah, like you're
Like-
bleeding so much that you could
but
maybe
like
lose the leg
But
or arm.
if like someone put it in and then pulled it out, then you might have to do it.
Yeah, that's right. Yeah.
Or if you're walking in the woods and then you hit like a branch and then it gets in your skin.
Well, if
And
it's
then-
if it hits like an artery or something, you have to stop the blood.
Because
Is the main
blood
reason
in
why
your
people
stomach.
die from accidentally stabbing themselves is that they take it out? Is that like one of the main reasons why they die from accidentally?
My mommy a little while
Or is
ago
that
she
just-
cut herself right here. She was cutting.
That I don't. From accidentally stabbing themselves,
Like,
It
and like when they take it out.
it depends on where they stab themselves. If you stab yourself in the hand and you took it out,
That wouldn't
You're-
be the worst.
you
because
probably aren't gonna.
My mom stabbed herself.
Yeah, you're not.
with
But
a
if you are running, say you're a kid, and you know how your mom or everyone don't run with scissors, right?
knife, and then
So
you
say
run.
scissors, you're running and say it jabs you in the stomach or chest. You fell on top of it. If you pulled that out, that's a possibility, depending on what got punctured when you fell on top of them.
Yep.
So we're going to elevate the injury and put direct pressure. Now they're talking about to know your pressure points. Okay? If direct pressure and elevation do not slow the flow, the next step is to find a pressure point. The large arteries found close to the skin surface supply blood to your head and to each arm. So there's different pressure points. Like, you know how to take your pulse?
Mhm.
So that's
I know there's
You do
one.
this or you do this?
Yeah.
Or you just
And
feel over the
do you guys have your books open?
Yeah.
And see by that skeleton, that picture, it's showing us different pressure points. The most common pressure points used during first aid are located in the upper arm. See up by the arm, it's up here. That's the brachial
Brachial
artery, yep. And in the creases above the upper leg, which is up by your groin, there's the femoral artery. If a wound is located on the victim's neck or arm, apply pressure with your fingers to the closest pressure point. So what they're saying, so if it's on your arm and you can't get it to stop and you've elevated it, right, and you're applying pressure to it, so the next step, and this is why sometimes you need more than, they show her doing it. They show the girl, but it takes, she's holding his arm up, and then she's also getting the pressure point to try and stop the flow of blood.
Or like if you have a watch on, you could use a watch to tighten and like tighten
Well,
it.
whatever works, I guess.
Yeah, that might not, I don't know that would get tight enough. I mean, that's really only going to affect the blood in your hands. I guess if your fingers were really, you could.
But like you could
Well,
take
yeah, but
your
her watch is like made out of rubber, like it's yeah, so it can like stretch out.
How does an unconscious ant get to the hospital? That's a funny joke on the bottom.
No, wait. Where is that? How does an arm? In an
Antibalance.
Antibalance.
Antibalance, yeah. Yeah, but they say ant in front of it, yeah.
Antibalance.
So do you know how to take your pulse? There's two places primarily. I mean, there are other places, but here
And here.
and your neck here.
Yeah.
Those are the. You can take it in your ankle. I mean, there are other places that you can take it, but usually.
That's the carotid artery.
Yes.
So you can take it up here.
Well, that's not. You
That's
feel
not
it, but
the
that
best.
it's really in here that you would take
Or
it.
on here, like right on
Yeah.
top of the heart. Or this is the one on your arm is like one of the best.
No, your heart.
Yeah, on your wrist is where they usually take it. Yeah, I'm sure you've been to the doctors, and if they're check your. Well, you're still little. I don't know. Do they start
They
checking you?
They don't do pulse yet.
They
No,
check
mine does.
They do the
They check my pulse.
the blood pressure.
They just do the blood pressure at mine. They don't do the pulse yet.
Yeah, they check my height, weight, my pulse, and my
Blood pressure, yeah. And
I
then
think they might
temperature
actually do the
sometimes.
pulse, maybe.
No.
You know, you probably don't even know because they're just holding your wrist and you don't realize what they're doing.
What? Yeah, sometimes they'll just be like, they won't tell you. They'll just like say, roll up your sleeve.
Yeah, and they're just doing that. Yeah.
They're holding your wrist and watching their watch.
Yes.
Yeah.
Yes.
Yeah, they'll hold your wrist or look at the clock because that's what some people do. They just look at the clock.
Yeah, if they don't have a.
Or they count in their head.
Mhm.
Yeah, usually mine just like count. They're like,
It's like
1, 2, 3, 4.
The normal heart rate is usually between 70 and 100. Adults' normal is between 60. That's for 10 to 12-year-olds. Your heart's beating a little bit faster. As we get older, our heart rate should be between 60 and 80. And I will tell you, if you exercise and do cardiac exercise, your heart rate will be lower. Of course, today I didn't do anything, but my resting heart rate is typically around like 57.
Mine's 113.
But and the only way that decreases is by doing walking or running, anything to get your heart beating fast. And that's going to strengthen our heart muscle, which is very important for all of us. Okay, let's talk about a headache. Splitting headache, okay? Head injuries usually fall into one of two categories: scalp injuries or brain injuries. So what would a scalp injury be, you think?
If you get hit in the head.
Well, scalp injury may be a cut. Maybe you fall off your bike and you have a good cut there. Maybe you need stitches.
Ben has a cut on the back of his head because he hit Miss Sutton's tooth with the back of his head.
Oh.
He went.
He wasn't bleeding though.
Scalp.
No,
And I will tell you from firsthand experience from my son Steven. He was probably. Andrew was in preschool, so I don't know. He was in elementary school, but he was going to wait for the bus one morning, him and Daniel, and they were messing around with bikes. And something happened, and Steven fell, and he fell just right on a rock, and his hair was really blonde then. So it wasn't a deep cut, but the blood, it looked like his whole head, because his hair was so light, and the blood just, because anything on your scalp, it could be a small cut, but it bleeds and it looks bad. I mean, in any
Yeah, that's why you always have to wash the cut first.
Yeah, it has to be washed and clean.
Like if you don't see the cut, then you don't know how bad it is.
Yeah.
Because if it's just like a teeny little cut, then you're just gonna put a Band-Aid on it.
But like your
But if
hair,
it's a huge,
your hair, if you had the same cut as Azalea, your hair maybe at first you would know it was bleeding, it was wet. But like her hair is so blonde, it would look like her whole scalp might be bleeding.
I wouldn't be able to.
Yeah, my hair might turn red.
Yeah.
My hair is like my grandpa's.
And you see the red, and it's like,
But
It-
mine
I'll
would
never
hurt
have
a
to buy-
little bit.
No, it would change, but it
would
wouldn't
show
be.
a little.
Yeah.
But it wouldn't be as.
It wouldn't be. Yeah, it
I
wouldn't
wouldn't
be.
have to pay
It
for
wouldn't be
red
like-
hair dye again.
Well, it
It's
washes
like-
out. I will tell you, it washes out. It doesn't stay red.
Yeah.
So that would be considered a
I
scalp
would just
wound,
get a
right?
red tint in
So
my
what?
hair.
Let's talk about
You know how bad that would be for you.
scalp wounds. Often bleed excessively, even though they may not be serious. You should first call for medical help and then work to stop the bleeding. Also, check beneath the tufts of the hair for any hidden injuries. Raise the victim's head and shoulders above the level of their heart. Place a clean bandage or wound, like always, we place to encourage the bleeding to stop. Be careful not to apply pressure to the scalp, since there may be a skull fracture. Depending on what happened, how hard someone, if it's maybe it was a car accident or something, there might be other injuries besides just what the bleeding you're seeing. Once the bleeding is under control, place a clean. Okay, brain damage, like concussions, right? Have you heard about concussions?
Yeah, like Hope's sister got a concussion once.
A sharp blow to the head can result in a concussion, which is a jolting of the brain from one side to the other. So our brain is inside our skull, right? And then there's liquid, and then there's our brain. So our brain's kind of there, but there's a lot of liquid. But now, if you stop fast, like even like the car stops and your body is moving some, so your brain is going forward and back inside your skull.
We've been learning about Newton's laws of motion, so this is
Yeah.
related to that. This actually.
Because your brain, and that's what you can get. The concussion is like a bruise on your brain because you've stopped with such force that your brain is hitting the inside of your skull.
Yes.
That's what's happening.
And you
What
can't even
kind of
notice.
concussion cause?
It depends on how bad. Concussions, they can have headaches. People can have severe
Yeah, there's
problems.
some
Jesse
people
knows.
Dizziness.
I
get
think
hit in the head.
Yes, nauseous.
They could lose their memory if they get hit really hard. They could be like,
Yeah.
wait,
It is
where am
certain
I?
Blurred vision.
Blurred vision. And the big thing with concussions also is like, say you're playing a sport or however it happens, you get a concussion. It's important that you have to let that heal, because what happens a lot of times. So
If
say we
some
have this
people
bruise, right, on the inside of our brain that we can't see, but it's there from our concussion.
You don't even notice.
Well, you're going to notice because you had the headaches or you're not feeling right, and the doctors and mom will probably take you to the doctor and have it checked out, and the doctor may say you have a concussion.
How long do they last?
Okay, I will get to that. So if you have the concussion, right, and the doctor's going to tell you you need to rest, you need to be careful, maybe not play sports because you don't want to get another head injury, because now that bruise is still there. Now, if you fall again, even maybe not so hard, but again, now that brain goes forward again. So that bruise that's already there is getting injured again. So now that injury is worse than it was before. Now it's going to take longer to heal.
And if you subject yourself to repeated concussions, the damage can be permanent.
Yes, it can, and
This
that
happened to football players and boxers.
Yeah.
They've had a.
So we have to be really careful with our brain. Let me see if they say anything here that I missed, but it's jolting of the brain. See, a more serious head injury could result in a contusion to the brain. Contusion. Along with many head injuries comes a period of unconsciousness. Other symptoms to watch for include clear or reddish fluid coming from the ears or nose or mouth, difficulty speaking, headache. Checking the pupils is important. That's what they usually do. The unequal pupils, pale skin, paralysis of an arm or leg on the opposite side of the wound. While you are waiting for help to arrive, please keep the victim lying down, control any bleeding, and be sure that he or she is breathing properly. As with many other injuries, internal injuries, do not give the victim any liquids to drink. If the victim is or was unconscious for any amount of time, keep track of that information so you can report it. Because when the ambulance gets there, they're going to ask you, were they unconscious? Even if they just hit their head, blacked out for a second, they were unconscious. And it's important because that will let them know to keep documented that, so when the doctor looks at it, okay, they were unconscious, or no, they weren't unconscious, to look at the severity of the concussion if that's what they have.
Yeah, because
what happens when you're
you can have,
unconscious? Like,
What happens? You're kind of
dizzy. It's just like you could. It's
yeah, you're kind of. It looks like you're kind of asleep, but you're breathing. But it really depends on what is caused.
But
if people are unconscious for a long time, sometimes they don't come back to us.
What is it called?
A coma?
A coma? Yeah, a coma. That's the one that's more severe.
The other thing, quick, there's a few pages on it, and then I got to assign your homework, is they talked about, respiratory, but like your lungs and breathing, but it was choking. Have you all know what the Heimlich maneuver is?
Mm-hmm. You pull at the belly, the stomach,
and you kind of come up towards the ribs, yeah. And now it's important if someone can, like if they're coughing.
But some people could do the Heimlich on themselves. They're really good.
Well, I think when people are desperate, they could do it on themselves. They could do it on a chair, because the universal sign, if someone puts their hands around their neck, they're choking. They may start turning blue. But if someone can talk, they may be coughing a lot, but if they're talking,
they're not choking, really.
Well, they don't need the Heimlich, though. You know. That's, because a lot of, sometimes they can cough it up. We've all taken a sip of water or anything, and it goes down the wrong way, and you're like,
my minor coughs.
Yeah.
And after he drinks, Mom goes, "Is there bones in that water?"
Right. Yeah. So we've all done that, because sometimes you cough and it goes down. Because what happens? Let's write page 146. No, not 140. Page 46. You're going to do the quick check. And it's 1 through 6, and they're true and false. So that is due on Monday.
Oh, okay.
Can you write that down?
Mm-hmm.
What page is that again?
Page 46.
Page 46, 1 through 6.
You put it on the homework.
You put it way there.
You say
Monday today.
Monday.
Why don't you put it in your time?
That's what it is.
Page 46, 1 through 6.
Page 46.
I forgot too. All right, that's why I asked Mrs. King.
You can still put it up.
1 through 6.
You might want to put towel in front of that, so you know it's Sunday.
See, and you know what you were saying, Azalea, is important.
March 8th.
We have an epiglottis. We have this small flap that goes between our windpipe and our esophagus, and it moves back and forth. And if you think about it, when you swallow, you're holding your breath. You're not breathing, so the epiglottis is moving and covering, so the liquid doesn't go into your lungs.
Because if you're swimming and you're breathing while you're swimming, if you sort of breathe, because if you're swimming over the water and then you get water in your mouth and it goes in your lungs, that's very severe. And
you can, because water in your lungs, it can cause. It's actually called aspiration pneumonia.
Can you drown from that? You can drown from.
You could also drown from just drinking soda.
Yeah, you can drown from drinking a cup of water.
Or soda.
Yeah.
Soda. Why?
But that's
because sometimes it goes down the wrong place. Because there's
Well, I think.
Of it.
Yeah. No, I think it doesn't matter. You can anything. But that's why it's important to chew your food and not be talking. And when you're eating, you want to make sure you're. What time is class over?
101. 101.
Almost.
Well, it's practicing.
Well, you got another minute. Go.
There are 2 minutes.
2 minutes. You got 2 minutes.
It's 12.
Do you have any other questions about health?
No.
Just make sure you have your homework for next week.
I feel like Reed wasn't asking enough questions.
Yeah, but you were the question.
Yeah, Reed.
Yeah.
Stop sitting
During your virtual thing, just start asking random questions. They might get answered.
Tell him page 146, 1 to 6. Page 47, yeah.
Page 46, 1 through 6. Is our homework. 1 through 6, quick check.
Yeah.
Reed, want to see the drawing of a rat I did? I drew a rat.
You could show him.
Wait, where's my picture?
Cheetah.
I drew cheetah.
Cheetah. Gotta get closer.
And Gavin did. Okay,
Cheetah.
and that's an ostrich. Here comes Steve.
I drew a rat and a bear.
And the bear has a very long tail. But you missed the funniest thing. We're thinking of a best-selling movie.
Alright,
It's
so
about my brother.
Ben gets bit by a radioactive brick, and it gives him
Brick
superpowers
powers.
that makes his head super strong, and he can run through solid metal.
And then
And then he calls for an ambulance.
they
and he
say
goes-
you need an ice pack, and he's like, no, I'm fine. And he just walks away on his bricks.
No, he floats away on bricks.
No, he's just like.
Yeah, he makes a brick tower.
And then
he just floats away.
accidentally it falls on people. And then he's like, oh, the ambulance is for you and you and you and you and you and you and you.
When is Earth Day?
What time is it?
Oh yeah, I saw someone putting up posters.
But what time
is it?
That was Miss
April
Gardner.
19th.
Isabel, what time is
April
it?
19th.
That's a lot.
Yeah.
Hold on, wait.
Yeah, we have to
Okay, I know how to turn the thing off.
Off.
You can